6 after my rhinoplasty operation. The bruising has significantly reduced today, so it's very, very faint under the eyes. I expect it will be nearly invisible by tomorrow. The swelling is reducing at the normal rate it has been. As for discomforts, I am feeling more and more throbbing sensations in the bridge of the nose, which aren't too uncomfortable, just a different sensation that I haven't really experienced. The cast itself is almost feeling tight. I'm not sure why. On top of this, I've also had a lot more dried scab material pass through my nose today, which has improved my comfort significantly. The small pieces of scab are very, very irritating and are very difficult to remove. I wouldn't recommend attempting to do so with a cotton bud or anything else. I've just been very regularly applying the saline solution, and that's helped to increase the rate in which they come out, which means I don't have the irritation. And the irritation also led me to need to sneeze, which was very daunting. I did my best to kind of sneeze through my mouth rather than my nose, but that could have been quite bad, I assume, nevertheless. Other than that, a lot of the effects I'm having now are just along the idea of anxiety about how my nose currently looks and what it will look like. And one of the things I found very helpful is to assess my pre-op photos, because while I'm busy assessing and analysing every small detail I can infer about my nose in its current state, in reality I can look back to things I wasn't happy about and notice that they are actually not there anymore. Whereas other concerns I had, such as has the length of my nose changed significantly, I can quickly rule out as, well, no, not really. It might just feel like that because the relative width has decreased. But again, I mean, I would emphasize that I don't think it's a very good thing that I am so analytical about it. But I found that if you are like me and you can't help yourself, then looking back on previous photos is relaxing, to say the least. Especially in my case, where the changes you wanted were reasonably minor, or not so much minor, but there was no obvious flaws. It was an overall improvement to the aesthetic. There wasn't a particular hump that I was looking to remove or a particular crookedness that was very innately obvious. And so looking at my previous photos helped me to say, wow, yes, that was not a great nose before, and I can see this is going to mold into a better one. Some more updates on that today, since the healing process now is pretty consistent. Every day the swelling reduces a little bit more, every day the bruising reduces a little bit more, and every day the amount of scab material that I can see reduces more. My breathing improves, and all of those effects take into account. I'm finally getting in slowed but full breaths of air. Hopefully that will increase. It's definitely not back to its original state pre-operation, but there is still a lot of swelling and a lot of debris up there, so I'm quite comfortable about that. I now have all of my sensations of smell restored, which has made eating a lot more pleasurable as well. Previously, the nose was so congested with scab material and mucus, and indeed the antibacterial ointments, that I didn't have much of a sense of smell. I was still very pleased with the amount I could breathe. I wasn't completely blocked with my nose, but every day now I'm noticing that how much worse it was the day before. So it's a very positive improvement, and it's something that's quite good. Apart from that, there aren't really any other additional updates today. I continue to take my medication as prescribed. I'm now down to just the antibiotics and the prescribed vitamins. And so far it's going well. I was due to have my cast removed tomorrow, but that's now been delayed into the day after, so I have an additional day with the cast, which isn't too much of a problem. But it means it should look even more the better when removed, one hopes. Thank you very much. Tune in tomorrow.